Welcome, good afternoon. My name is Kim McNulty and I am Vice President of Regional Strategy for One Future Coachella Valley. And we're delighted to have you join us this afternoon for our Mental Health Matters webinar series. Today, we're going to be talking about careers and community college pathways. And this is the third in a series of 4 that we'll be doing this month to celebrate Mental Health Awareness Month. And our behavioral health alignment team has designed these programs especially with students in mind, high school and college students who are looking at what you want to do next. And we're hoping to encourage you and entice you to consider careers in behavioral health and pursue this path. So welcome, we're delighted to have you with us today. The format will be about a 30-minute presentation. We'll have a little bit of activities and then 3 wonderful panelists who are spending some time with us. And the program presentation will be about 30 minutes, and then we will stay on for Q&A with all of you. So thank you for being with us, and we'll go ahead and get started. I wanted to share just briefly about One Future Coachella Valley. We are a nonprofit in the Coachella Valley that is focused on helping all of our students graduate prepared for what comes next: college, career, and life. And we have a behavioral health workforce alignment team, which is comprised of about 90 community partners, educators and business partners, behavioral health professionals, and healthcare professionals who are all working toward creating opportunity for local students and to help create awareness of the tremendous opportunity for careers in behavioral health, because we have a great need in our Coachella Valley for that. So as I mentioned earlier, we're really hoping that some of you on this webinar will consider these pathways and then tap into the resources that can support you. We have some framework for today's presentation. I shared a little bit about what the program is going to be. And in addition, we would just ask that all of you demonstrate courtesy and respect for others on the call. We do have a Q&A feature, and we would love to have you engage. So please post questions in the Q&A. You may also post questions in the chat or comments in the chat, and we just ask that those remain positive. This is a friendly learning environment. We, again, are creating this opportunity so that all of you have a chance to meet professionals and learn things you didn't know. So please don't be shy and ask questions of all of us. And with that, I think we'll go ahead and jump in. Before I introduce the panelists, I'm going to turn it over to my colleagues. I first of all want to say thank you to Eloisa Lopez, who's part of our One Future team, who's coordinating these webinars. So Eloisa, can you say hi?
Hi, everyone.
Thank you. And then Ariana Arias, and I'm going to turn it over to Ariana, and she's going to do a poll for us, I think, before we jump in.
Hello, thank you for joining us. So I'm going to do a poll just to gauge kind of like your level of understanding of community college and behavioral health career pathways. So if you could please answer it, and then I'll show the results at the end. And I'll give you around 30 seconds and then I'll share the results. All right, 10 more seconds left. All right, now I'm going to share the results. And the majority, most of you are slightly familiar or moderately familiar, and we do have some that are very familiar. So thank you for answering the poll.
Very good. Well, for those of you who aren't familiar, you are definitely in the right place today, because our panelists are Wendy Duras, who is the Regional Director of Healthcare and Employer Engagement for the community college system in our region, and she is an expert in all things healthcare and community college. So Wendy, we're thrilled to have you with us. And we also have Lonnie Mills, who is a nurse and also a nursing instructor at College of the Desert, which is our local community college, and she can share about the programs and resources there. And then Valeria Bordas is with Riverside University Health System's behavioral health, and she's a social services planner, and she can give you some perspective on careers within behavioral health that you can access from the community college launching point. So with that, I'm going to turn it over to Eloisa to kick us off.
Yeah, so I'm going to stop sharing my screen and we'll have Lonnie Mills start the presentation.
All right, and this would be me. My name is Wendy, and thanks for coming on this Friday afternoon. I wanted to talk to you a little bit about what the heck, and by that I mean you must be interested in a field of psychology or mental health or behavioral health, psych mental health. There's so much terminology out there. I wanted to kind of sort through that with you. So behavioral health, mental health, psych mental health, and psychology all is in the same vein of helping people with mental and behavioral health problems. However, there are definitely different pathways to take based upon what your skill set is or what skill set you want to build. So where do you want to go? How do you get there? How long will this take? What schools have it? And how do I know which one fits me? And what colleges near me have these programs? So that's what I would like to take a moment to review. And so there's some helpful links here. And if you would click on the first link, the Florida Experience, regardless that it's Florida, this is a great link that helps you determine what the difference between behavioral health and mental health is. Do you have to do control click? And I think you have to share a separate screen when that opens, Lonnie. And then I'm going to go to the Workforce Initiative and then SUMHLC, just to give you some idea of where you can go for some of this information. So we're going to bring it up to this website, and on the very front of that, it talks about the difference between behavioral health and mental health. And so do you want to work with persons who have mental health conditions like schizophrenia, bipolar, major depressive disorder? That's one area. Do you want to work with somebody who has a drug and alcohol problem, a codependency issue, behavioral issues that may or may not be related to a cognitive problem? They're all different categories that you might be drawn to. So this is that website, and I wanted to make you aware of that. They're very different. And so you'd want to give some thought and do some research as to which direction you want to go. Lonnie, if you go to the second website, this just gives you some background information and some definitions. And then the Health Workforce Initiative for the state of California, it actually has, and if you don't know this, Zoom users, at the top of your screen, you have a view option button, and you can make the presenter's screen much, much bigger if you can't see that small print. I'm going to do that myself because it comes across pretty small. And on this site, you actually can go and find out exactly what schools have what programs and the title of all the programs in the state of California. And this isn't just mental health, it's everything in healthcare, but it sure can give you information. Like I see alcohol and drug counselor, it'll take you to all the programs that have that. And we've got psychiatric technician programs. It would take you there. And a lot of these are housed in different areas of community colleges. Maybe it's in their social sciences, maybe it's in their psychology, maybe it's in their health sciences. So you have to do a little bit of research to find out what you want to know. Now, HWI's website is open to the entire state of California. Anybody can look here at the resources, and they have a health occupations directory as well as a Exploring Health Careers downloadable book that'll give you way more information in the career ladders that are within this field. And Lonnie, if you would go to the third link on the slide, we're going to talk a moment about that. Peer support specialist is one of the newer titles that is coming around the community colleges as an option to get a job, as well as counselor. Now, I don't know if you're thinking to yourself, I want to be a counselor. That can mean a lot of different things. There's educational counselors, there's health counselors, there's community health workers that function as counselors, and then there's true counselors in mental and behavioral health. Once again, that field is so broad that you really have to narrow down what it is you want. Do you want to work directly one-on-one with patients? Do you want to work with a group of people? Do you want to work with adolescents, teenagers? Do you want to work with the older population, geriatrics? So you really have to explore this. Lonnie, is this the third one? Yes. So this one talks most specifically about behavioral health and drug and alcohol counselor. And there's many different levels of that. There's certifications in that. And I just wanted to bring those to your attention. So Lonnie, if you go back to the slide deck and go to the next slide. This is what One Future has created and HWI, with their permission, has kind of worked with is, and we can make this available to all of you, is where do I go and what are those career ladders? So from high school diploma or GED, you can take a certificate program. What does that mean? It's less classes and less units than a degree, but it will get you a job. And then you may want to go to an Associate of Arts or Science. They say it's the 2-year degree. It may take a little longer because you have prerequisites or you need to get your classes, but that's your associate degree, leading to your bachelor's degree. And then that goes down to master's. Most things in the mental health world are going to be at the master's and greater level if you want to be a counselor, psychologist, psychiatrist, and those family MFTs. Those are going to be a higher level, but you can start mental health at a certificate program as short as 6 months. And I recommend career ladders because you can get your feet wet with a short-term program, make sure that's the career you want and build upon that career and make money while you're going to school. So this is kind of an idea of where to go. And so many acronyms, you really have to study this. My last point before I turn it over to Lonnie is don't pick a program and hope to get a job at the end of your program. Pick the career you want and the job title you want, then go find the education that matches that so that you will have a job when you finish. With that, I will turn it over to Lonnie. You're on mute, my dear.
Oh, you'd think I never used Zoom before. So hello, everybody. So I'm going to talk about just kind of the nursing aspect of it. So we're going to talk about mental health, kind of what are the areas that nursing can do, what do you have to do to get to those areas, the different certifications, what can COD possibly offer you, what programs we have. So it's just going to be a little glimpse into the world of mental health from a nursing perspective. So what do mental health nurses do? That's what a lot of people ask. Is they say, well, is that different? Is that different than a regular nurse? And they actually do have a different focus, because in regular nursing, we're worried about the body, but with mental health nursing, we're worried about the mind. We're worried about the soul, the spirit. So we're more, our focus is more towards that. So we have a lot that we can do. Our actual scope of practice is pretty large within the mental health field. There's also, we can have psychiatric nurse practitioners. So once you get your RN degree, you can, there's kind of a level system almost. So you can get your RN degree, you can get a job, you can start working and start being a nurse. And then after you've done that for a couple of years, you might say, you know, I think I could go to the next step. I want to take this further. Well, in nursing, it's great because that you're able to, so you can go to the next step. And that's all through education. But the nice thing about nursing is a lot of these programs are online. So you can still work and advance your degree at the same time. So that's the other nice piece with nursing. That's a little bit different from some other career paths. So you could get your clinical nurse specialist, psychiatric clinical nurse specialist, psychiatric nurse practitioner, and psychiatric nurse just as a certification. But before you can do any of those roles, you have to be an RN first, right? So College of the Desert, we can definitely help you with that. So the other certifications for mental health, they have what's called a psychiatric mental health nursing certification. And this is if you're an RN and you're like, you know, I'm happy being a nurse. This is just where I want to be. I love this field. I want to get specialized in it. This is what you can do. And then you can also get the psychiatric mental health clinical nurse specialist certification. And then also, again, the nurse practitioner certification. So employment, a lot of people are like, okay, so I have these certifications. I have these degrees. Can I get a job? Well, nice thing with nursing, yeah, there's always a job. There's always jobs for nurses. You can do anything within the nursing field. So it's really nice in that regard. So the U.S. Bureau of Labor Statistics reports that more than 2.95 million nurses were working in 2018. And we have even more, or we're going to need even more as some of these nurses are retiring. So there will be more opportunities for you to go into really what you want to do. So RN, yes, it's a lot of school. You have 1 to 2 years of prerequisites that you have to do. You have 2 years in the program, and then you have to take another test called the NCLEX to achieve your licensure, and that's through the Board of Registered Nursing. And then you still have to go and get a job. So it's kind of hard if you're like, well, I'm out of school, I need to get a job right now. Maybe a different path would be better. That's where sometimes people will go to the LPN or the LVN. Some people are more familiar with that. So we have an LVN program, and that takes about a year of school. So it's a little shorter. You still have to take the licensure exam, and there's a little bit more limiting in where you can work, but there's still plenty of jobs. But then if you're like, well, I don't know if I can I take a year? That's a long time sometimes, right? Well, we could go to the next step. We have mental health technicians, and we also have, coming soon to College of the Desert, we have a peer support specialist certification. And that's a very short time. You don't have to be in school for very long. You can get that certification, and then you can go and get that job. Now, the outlook for a peer support specialist is pretty good, actually. They make about $28,000 a year, which I know doesn't sound like a lot of money, but it actually is for a fresh start position. And they have job openings. I did a job search so I could give you some good data. And we actually have job openings in India right now for peer support specialists. So there's definitely opportunity, and this is nice, short, sweet. Get your foot in the door, see if you even like it. And then once you're in it, you can say, you know what, I really love this. I'm ready to go to the next level. Then maybe do LVN or LPN. And do that for a little while. Be like, okay, I'm ready to go to the next level. Then you can go to RN. The nice thing about the LVN piece is if you have an LVN, you get to skip a whole semester in the RN program. So that means only a year and a half once you have your LVN degree. So that's kind of nice too if you use that stepping type format to get into mental health and to advance your career. So there's, for the peer specialist, there's a certification process. It's a national certification. So the nice thing about that is you're not limited to just being in California. Whoever participates in this program, you'll be able to take that wherever you go in case, you never know where your life's going to end up, So mental health, basically what I want to get across really is that mental health has so many opportunities for you. And you can make good money. You can start very low and then work your way up. That's what a lot of us have done. We started at the bottom rung and we've worked our way up. So start at the bottom and work your way up. Make sure that you like it. Have your foot in the door. Get some money coming in. It makes it a lot easier to go to school and really figure out, is this what I want? And then once you figure it out, sky's the limit, right? So above all, this is very important for anybody, not just mental health. Be who you want to be, not what others want to see. I love that saying because sometimes we get kind of put in a preconceived idea of what we should do, but you know what? We can do anything and be anybody we want. So that's my message to you. Okay. And then I will turn it back over to Eloise.
Yes.
Okay.
Thank you, Lonnie and Wendy, for presenting on that. Sure, it was really helpful. Next, we want to hear from Valeria. I know it's helpful to hear from people that are working in the field, so we thought we would invite Valeria to speak about her current role with Riverside University Health System, and then also as an AMFT. So Valeria?
Yes. Hi, everyone. Very happy to be here today with you guys. So I work with Riverside University Health System, Prevention and Early Intervention. I work under the Behavioral Health Department with Riverside County, formerly known as Riverside County, but now it's RUHS, PEI. So I'm really excited to share what PEI represents in our community, in your community, because PEI is relatively new. It's under the behavioral health umbrella, but it's very, very specific on what we provide. So this is something that if you're interested, if you're passionate about mental health, passionate about helping your community, prevention early intervention is something that maybe you can look into. So what prevention and early intervention stands for is really to increase awareness in our community of mental health. We increase awareness by breaking stigma and also preventing the development of mental health problems by providing individual support, by building skills within the family. So really, we do a lot of skill building and education for the families. So we talk a lot about what is mental health? How does mental health impact our lives? Why is mental health equivalently important as physical health? So prevention and early intervention is in every county. It's part of the Mental Health Services Act for the state of California. And it's really an exciting field to work in. I feel very fortunate to be able to work with families, with individuals, because we're building those skills that overall help protect them and make them more resilient. So that's a very exciting part of prevention and early intervention. So we're in every county. Riverside County specifically has many programs under PEI that are currently in our community, building those skills, breaking stigma, and just having an open conversation about what is suicide prevention, what is mental health, and things that really open a conversation to build strength in our community. So I'm very excited that I can share that side of mental health because it's not very well known. So how did I get this position at Prevention and Early Intervention? First, I started at community college. So I was able to complete my prerequisites for transferring to university at San Bernardino Valley College. So I think someone from San Bernardino Valley College is here. So hello, I'm very excited. I love San Bernardino Valley College. It's very close to my house and close to my heart. I actually started attending San Bernardino Valley College as a high school student. I started attending San Bernardino Valley College, taking classes during my summer breaks, and I was able to add up courses so that when I transferred to the university, I was able to finish my bachelor's relatively sooner than the regular path. And so after completing those prerequisites, I moved on to my bachelor's at a university. So with that, I was able to major in psychology. And so at San Bernardino Valley College, I took as many psychology courses as I could. And then at the university, I was able to choose that major. I could share a little bit personal. I actually was a teen mom. And so just FYI, you know, it was something that really built that empowerment in me, actually, from being told that I was not going to be able to make it. I was not going to be able to attend college. That really stirred me and said, no, I am going to do it. So I was able to finish my bachelor's. And after I finished my bachelor's, I was not working in the behavioral health field. So I really sought to get that behavioral health experience. And the first place that was able to hire me was prevention and early intervention. So that really propelled me to then finish my master's degree. So while working with prevention and early intervention, I have completed my master's degree from Cal Baptist University as a marriage and family therapist. So that's pretty much in a nutshell how I was able to get that experience with PEI. So now my social services planner position is really that bachelor's level entry. So if you're interested in looking up what that position really entails, and a little bit more about PEI, I'm going to share our directory of services in our chat so you can download this PDF version. You can explore the programs that are currently in our communities right now, bringing awareness about mental health and breaking stigma. We currently have a lot of programs and they serve all ages. So I'm going to share that with you so you can get a little bit about what I do as a social service planner. And also I'm going to share my personal email as well as our prevention and early intervention email if you would like more information as well. I think that's pretty much what PEI does. It's really an exciting field under mental health. So I'm really excited that I was able to share that with you guys today. And I'll turn it back to Elisa.
Thank you, Valeria. If you all have any questions, please enter them in the Q&A for her or for our other speakers, and we'll answer them in a bit. I will share my screen again because Ariana will be doing another poll, and she will also be talking about a behavioral health resource.
All right, so I'm going to do another poll here. All right, so I'll relaunch the same poll just to see where you guys are at and see if you learn new information, and hopefully you guys know more about community college and behavioral health pathways than you did before. So yeah, I'll give you about 20 more seconds. All right, great. So I'll be sharing the results, and the majority of you were now are in the very familiar category. So thank you to the speakers, because I really learned a lot. So hopefully the attendants did too. All right, so now I'm going to be talking about some behavioral health resources. And the first one is the California Workforce Initiative. It was included in the chat, but it has a PDF file with different careers, and it kind of looks like this with the pyramid. So it tells you which careers match up with high school graduates or one-year certifications, all the way up to PhD levels. So it has a lot of different health careers, so like nursing, and even behavioral health careers. So that's a really good resource to kind of check out what you can do. And additionally, I found a really cool app. It's called the Here to Career app, and it was made by the California Community Colleges. So it basically lists a lot of the programs that are in the California Community Colleges, and it tells you exactly where to go, and it uses your location to so it knows which ones are around you and which ones are close to you, and then it targets which ones would be good for you, and you can create a profile so then you can keep track of the colleges and programs that you've been looking at. So yeah, it's a really easy app to use, and you can have it on your phone and just kind of keep looking at it and form your path into whatever career you would like to join. All right.
Thank you, Ariana. Now I would like to invite you all to attend our last webinar of this series. It will be next Friday at 2 p.m. We will have Michelle Downs. She's a LMFT. She also works for Riverside University Health System. We will also have Dr. Sharma from Brown University to speak about graduate school programs that they offer there. And then Maria, who is a licensed clinical social worker. And in order to register for that, it is the same link. So please make sure you register ahead of time. I would also like to invite you all to follow us on social media if you're not already. We will be doing a prize drawing for those of you that attended today. All you have to do is follow us and then share one of our flyers on your Instagram story. And so now going to check the Q&A and see if there are any questions from our audience.
So if anyone has questions, I want to invite you to share them. And for a moment, Eloisa, I'm going to share my screen and just do a quick pitch for the Desert Healthcare District Scholarship. So we are really fortunate in the Coachella Valley to have the Desert Healthcare District as a partner in this work. And they have set aside special matching scholarship dollars for us to provide scholarships to students who are interested in pursuing behavioral health careers. These are primarily for students who are junior or senior level undergrads or already in a master's program, and the scholarship awards are up to $5,000. What's really exciting this year is that we anticipate that students from across the Coachella Valley will be eligible for these awards. So I just wanted to bring that one to everyone's attention. You can contact One Future Coachella Valley or click this link, go to this link, dhcd.c2nav.com, and we're accepting applications through July 1st. So plug for the scholarships.
Thank you, Kim.
Thank you for inviting me to be a panelist. This was wonderful. I put my email in the chat in case anybody wants follow up on anything that I can help them with.
Thank you. Yeah, I currently don't see any questions, but Wendy, I know Valeria, you've also shared your contact information, and we will follow up with all of you with the recording of this webinar. And feel free to reach out to us if you have any questions after today. We're here to help you in your behavioral health career journey.
Thank you for inviting me. You know, Eloisa, just a question just came in about volunteering.
Yes.
Is it okay if I answer that question?
Yes, feel free.
I wanted to share my experience. I think volunteering is very, very important, especially going into the behavioral health field. A lot of times there's not a lot of experience out there before you get your bachelor's degree, right? Before you get your associates. So volunteering in community organizations, there's a lot of community nonprofit organizations in the community offering mental health services, free or low cost. They offer mental health events. So I would definitely connect to community organizations, but also RUHS offers volunteering experience as well under the behavioral health department. So you can also email PI at RU Health to find out how to get started volunteering. Definitely my volunteering experience is part of my educational career for sure. So I would definitely recommend it.
And I'm just going to chime onto that. I know that sometimes students are concerned about how they'll pay for their education, and organizations like Riverside University Health Systems have several employee incentives. So you can often start out at an entry-level position and then work and continue your education, and they will help pay for that education. Valeria, can you share a little bit about that?
Yes, yes. Thank you so much for bringing that up. That's very true. We have the gift program for if you're already working with Riverside County, or if you're interested in interning at Riverside County, if you're in your bachelor's level or master's level program, and there is employment incentives. So that's actually part of the reason why I looked for a behavioral health position under the behavioral health department, because I wanted to tap into those resources and I wanted to gain more experience because I knew I wanted to become a mental health therapist. So I was able to look up the county, the benefits, and also the resources that they have available for employees as students. And so I am a result of that. Really, I received tuition reimbursement from a Riverside University Health System while I was attending California Baptist University. So I would definitely look into that. So if that's the area that you would want to go, you would definitely want to look for a career, a position in that field.
I just also wanted to mention at College of the Desert, we also have for the RN program, we have a lot of scholarship opportunities because we get a lot of grants from different people within the community. So for students, once they're in the RN program or even in the LVN program, we do have the ability to help them, to help pay for, you know, we even have emergency funds because sometimes you're in school and you're like, I can't pay my rent. We even have helped people with that as well. So we have a vast amount of resources for their nursing program, more than I've seen in any other program I've taught in. So College of the Desert really is a viable resource to help you get through school. We do whatever we can to help you.
Excellent, thank you. I think there's one more question in the chat, Eloisa.
Yeah, the question is the peer support specialist program already available at College of the Desert?
Not yet. It's still in the formation stages. And so we will do some great advertising with One Future once that's up and available to join.
Thank you. And then another question, was it challenging to attain your internship position? Seems very competitive with many psychology majors. You're muted, Other.
Is that's question definitely for me. Yes, you know, it depends what university you are attending for your master's program. Depending on the university, you have to find your own internship placement, or the university finds it for you. So my experience with California Baptist University, I had to look out for my own internship experience. So it's definitely challenging. It is very competitive. I did not give up. I had sent numerous emails, left numerous voicemails, and yes, it is very hard. But you know, once you set your mind to something, I just told myself, you know, I'm not the only student that is working full time and seeking internship experience. I was very fortunate to get my internship experience while working with Riverside County at Harupa Unified School District in Harupa Valley, and it was a very rewarding experience being there. So yes, it was definitely challenging. In the end, it felt like I was meant to be there. So after a long, many months of looking.
I have a question, I think for you too, Valeria. And what kind of populations can you work with when you're working in prevention and early intervention?
Yeah, that's a great question. Prevention and early intervention affects every age group. So when it comes with children, we have programs that help build family bond and communication within the family to build those protective skills for the family. So that's the younger age groups. For adolescents, we're trying to create awareness. So we have programs that build strength in the school setting right now that are prevention and early intervention programs that build strength for adolescents, how to ask for help, how to recognize that you need help, how to recognize the early signs of emotional distress. And then we also have older adults as well, programs that are under prevention and early intervention. So we have programs on increasing skills for seniors. So we target all age groups under the prevention and early intervention. So that if we look at what is education, what is breaking stigma, what are those skills that increase support systems, it targets all age groups really. In all seasons of life, we need support, right? In all seasons of life, the importance of mental health never ends. So that's what we're trying to build, is that knowledge and awareness that we all need to take care of our mental health. And there's things that we need to do to take care of our mental health. So yeah, it targets all age groups.
Thank you.
Well, if there are any more questions, I think we will conclude today's webinar. Thank you once again to our presenters, to Wendy, Lonnie, and Valeria for joining us today. And I welcome all of you to join us again next Friday. We will be following up with you with the invitation and again with today's recording and our contact information. So please reach out to us if you have any additional questions. We're here to help.
Thanks.